first going to launch the symptom management for the doctor. First thing you do is you're presented with the login screen. The first time you enter it, you will need to use the login. On first entry, you'll have to enter your passcode, which will give you a convenience on subsequent logins. It then indicates there you need to backtrack to the login. It detects that you have a passcode, so it shows you the passcode screen. It then shows you your, since it's the doctor's app, here it shows them his patients, and as you can see, that's the first, last name, date of birth, and the MRN. Now, the first patient here is here, and there's no check-ins because we've just started, and there is no medications been subscribed. We're going to do that now. Okay, rather this is that one. And the chart doesn't have anything because there's no check-ins yet. Then we save that. And then we go ahead and log out. And that's the patient's, the doctor's input. Now we'll go over to the Okay, so patient now has medications prescribed to them. So this patient is registered with Dr. 1, patient 1. Okay, they're prompted for a passcode. This tells them now they need to go back. And so they enter in what they just programmed as their passcode. And now they have presented to them with their medications that they're supposed to take. And if this is a time for them to check in, then they would enter the responses to each of these prompts here. You know, yes, I took this and it's at this time that I took this medication. And I took this medication and I took that medication an hour or so later. And then they would submit that. Okay. And then they could set their alarms for when they're supposed to, take them, do their check-ins. So maybe it's 1 in the morning there early, 7:45 or something like that. And then maybe another one later on, 10 a.m., 10:30 maybe. And then another one maybe at in the evening. Okay. And then one more. And then that would show that we got 4 here. Then we save them. And then back out of that. And then suppose I do another check-in later on. And we go ahead and set the time when they did and save that. And then just to show how this all works, we'll go ahead and do a couple more check-ins and submit it. Okay. And then then we're done with this for now. They also have this media channel, which allows them to take a photo of their mouth or whatever, which I won't do. And then you could take a photo here, and that would then be okay. Now we are back in the doctor's app. The patient saw the new prescriptions. They set alarms. They checked in a few times, and now we're back here looking at the app, in which case now we're looking at the patient's list, and we'll select the first one here, which is the one that I think was logged in on the other site. So now you can see that there are 3 check-ins the person has made, and we can see what medications they took at different times there. That one they took, and the first one they took there. Okay. And then what we can do is we can see a chart of these 3 things. There's a chart for the various dates there, and you can see how that affects how they feel. Okay, so there's sort of a triangular there, severe in the middle there. And so now the doctor now has the option to change the prescriptions to accommodate the changing symptoms. And simply hits the save again, and that should then show up again on the patient's application. When they check in again, they'll see a change in their prescriptions. Now, there's the other thing here on here that we can refresh if we need to. Also, when we're in the main screen here with the patient list, we have the capacity to poll. That polling will check and see whether or not any of the patients have severe conditions, and if they do, it will send a notification to the app and vibrate the app and allow the doctor to respond in a more prompt way to their discomfort. So you can hit here, and then it would go ahead and poll. There again, now I see it polled because I have the polling really quick right now, and it immediately came up with a polling. So, I can draw down on that and then hit there, and it will go directly to that one with the severe condition, as you can see. Okay, and thank you. And I think that we'll see how we go with this first. Thank you.